And welcome back. Right now I'd like to welcome a couple guests from Alzheimer's Family Center that is up in Huntington Beach, and they are with the Mind and Memory program at Mission Hospital. I'd like to welcome first Linda Abbott. You are the Community Outreach Manager. Welcome.
Thank you.
And Dr. Cheryl Alvarez, you are the Director of the Outpatient Behavioral Health Program.
Yes, thank you.
And nice to have you here today. First, let's talk about what this program is, who you are as far as Alzheimer's Family Center, and how this came about. And I'm not sure who wants to talk about that first.
I'll start. So the Mind and Memory program is a partnership between the Alzheimer's Family Center and Mission Hospital in Mission Viejo. It's a very innovative program, the first of its kind in the country, and it's an intensive outpatient program that is for people who have both a memory issue of some kind, as well as a psych issue like depression, anxiety, or PTSD, or
so kind of both together.
Yes.
All right. And is that something that is more common in Alzheimer's patients? And are we talking specifically about Alzheimer's patients, or just people who have that sort of a memory problem that may not have been fully diagnosed for that?
We see a lot of different kinds of memory loss. So not just Alzheimer's disease. There's actually many forms of memory loss from different causes. But that is the common ground, is that there's both a memory issue as well as another challenge. And a challenge like depression is definitely a huge risk factor for this population.
Okay. So Linda, as far as what you do, as far as the community outreach, does that mean you go out and sort of work with other programs, getting the word out, saying that this is a resource that you can come upon and see if it's something that's going to work for you?
Yes, I speak with doctors, elder care communities, other agencies, and get the word out. It's a wonderful new resource in South Orange County.
Okay, how does someone, obviously you just said who the kind of folks you talk to, but what about the patients? Is this something then their care provider is going to talk about to them, and how do they kind of dovetail any kind of program they're on now or the help they're getting into this? Is it something that is that coexists with it? Is it covered through their insurance programs?
Yes, we're very excited because it's the first program that is covered by Medicare and most commercial insurance plans. So that's really exciting, and they don't have to stop other activities. In fact, we want them to continue other activities. They can come to our program up to 4 times a week, mornings or afternoons, based around their schedule.
And Cheryl, who benefits from this program, or I should say what type of benefits that these patients can utilize, because there could be certain stages that they've kind of passed that threshold.
Everyone benefits, right? So both the patient who's experiencing some memory loss, their caregivers or spouses who need a little bit of time to themselves. And so this is an opportunity for those people to go and be in a social environment, to work with a professional staff, to discuss and talk about things that are difficult maybe to talk about with their families. Most of the patients in our program are very mild in terms of their memory issues. So they're engaging in group psychotherapy, they're working one-on-one with a therapist, they see a psychiatrist, and so it has to be early enough for them to be able to do that. But treating the depression is such a big priority for us because depression is one of the risk factors, as I said earlier, that can actually progress a memory loss issue much faster, or can put someone at higher risk for actually developing one.
And what about any kind of medications that they may be taking? Your program, is it more about kind of talking about it and getting one-on-one with the right help you might need, or do you involve medications as well?
If indicated, we would involve medications. So, and that would either be done with their existing doctor, psychiatrist, or it could be done through ours as well.
And Linda, you had mentioned before we got on that you work with adult day programs. Is that correct? So is this sort of your version of it, or you work with local adult day programs?
An adult day program is different than than who we are. We're a
Okay.
half-day program. Adult day health care is usually a full-day program.
Okay.
Our partner is Alzheimer's Family Center in Huntington Beach,
Okay.
which is the only dementia-specific adult day health program in Orange County.
Okay. And do people who sign up for this program, do they go to the one in Huntington Beach, or do they go to Mission Hospital that's right up the road here?
Mission Hospital.
Okay. All right. Now, as far as how often? Daily, couple times a week?
We recommend people go at least 3, but sometimes people go 4 times a week.
Okay.
Half days. And
Right.
we also provide free round-trip transportation door to door anywhere in Orange County.
Okay, very good. Now, as far as memory screenings go, Cheryl, how do you go about that? And is this something that would be through their care provider, or anyone who says, you know what, I want to be screened for memory loss?
Yeah, so memory screening, it's very exciting. It's actually a new service that we're offering for the community, that anyone can come in and just receive a memory screening. We offer it on the
First Friday of every month.
Of every
Okay.
month. Thank you, Linda. Yes.
Okay.
And so people can call, they can make an appointment, come down to Mission at our center and receive a free memory screening that will help determine whether the kinds of experiences they're having with their memory are
Okay.
normal, or that they might be indicative of some further evaluation.
Okay.
You know, it's interesting because we all go to our annual checkups for our eyes, our ears, our bodies, but we forget to check our brain. And
Yeah.
that's the engine behind everything.
Right.
So it's really, really important to
Yeah.
do that.
Yeah, very much so. Now, for something like that or anything, call the number, and the number's on the screen. It's 949-364-4203 for this program. And by the way, the website's on there as well, missionforhealth.com, /mind and memory. And from there, you can kind of see what the kind of programs are available, what kind of help they may or may not need.
Absolutely.
Very
Yep.
good. Now, one other question, just to clarify, if they are on some other program or something that's being done with their own physician, that's something that would be incorporated with this? You would work hand in hand with them, I guess is what I'm saying.
Yes.
Okay.
So we'd want to stick with their team of providers,
Right.
work with their physician. Some of our patients also attend other programs or go to adult day health care as well, and that can be integrated as well.
Okay, very good. Nice to have you both on.
Thank
Thank
you.
you so
And
much.
again, if you think you might benefit from this, give them a call, 949-364-4203. And then the website is missionforhealth.com /mind-and-memory. We'll be right back. Thank you very much.
Thank you so
Thank
much.
you.